Our goal and mission at Covenant in treating patients is that we are treating the whole patient in the context of their life.
Their cancer is not them. They are a whole person, and we want to treat the whole person emotionally, physically, spiritually, make sure we're meeting all the needs, not just offering a drug. We want to be there for the whole process.
I started my journey back in 2013 with breast cancer. In 2017, I was diagnosed with metastatic, which had gone to my lymph and my bones. Eventually, it moved into my liver and then my lungs, and most recently, it has gone into my brain. I have found every single time I have a question or every single time I have a need that Covenant is the place that I need to turn to for my answer.
It's very upsetting to hear those words, cancer. I never would have imagined. We don't have a family history of breast cancer, and so to actually hear those words that I had cancer was, it was tough. It's hard to believe that I can honestly say that I'll be cancer-free for 1 year.
What we do with taking patients beyond just the clinical treatment phase and integrating that treatment into their daily lives allows them to continue with care.
Right after I was diagnosed the first time, I had received a call from Covenant nurse navigator that had asked if I wanted a support group, and I joined, and they've been most helpful. Someone to lean on that knows my journey and the feelings that go up and down with the grieving process.
Being a part of a program that takes care of the patients in the way that we do is what keeps me going.
Everyone is concerned about the patient. How are you doing with treatment? How are you getting through today and tomorrow? How are you doing with next week? What can we help your support person do?
In fact, we have support groups here for our patients, but we even have a support group that is for patients and caregivers. The patients' families are just as much a part of the process.
We also follow the patients all the way through survivorship. We want to make sure that they feel supported moving on in their new normal and in their new way of life.
Beyond that, we also have social workers here, a financial navigator, because financial toxicity is a really unfortunate part of a cancer diagnosis.
I also used other services as far as they have a dietitian, nutritionist who helped out when I had questions with what I should eat, what I couldn't eat, OT, so occupational therapy and physical therapy both. The nurse navigators, the physicians, the medical assistants within the physician groups, to the nurses that helped with infusion, radiation department, oncology, all of the above. They've all been absolutely wonderful. Hugs, smiles. They get to know you and really help you through this process.
You're not alone in the process. Covenant has answers and can find you the answers that you need specific to your diagnosis.
I have my family, I have my work family, and now I have my Covenant family.
I still have my support people, and it changed over the 11 years. But Covenant's always been that constant that I can reach out and find my answers. And you get to know these people by their first name. Chuck will park your car, and the front desk person will always say hi. When you get off the elevator, there's always somebody there to greet you. And the office of the nurse navigators are well known, and you'll find a habit of stopping at their office just to give a hug on your way out the door. The nurses that give you a poke when you have to do your chemo, you'll start scheduling your chemo on their days because they're your favorite one. And it becomes a family because you will get to know their kids and their Christmases, what sports their kids play in, and it makes life better. Covenant Healthcare is the place that I go. It's my hospital.